Long-distance travel can mean hours of sitting, which can increase your risk for blood clots. And on flights, that risk can be up to 3 times higher. While serious clots linked to flying are rare, doctors say it's important to know your risk factors, how to prevent problems, and what warning signs to watch for. Reporter Viv Williams takes a closer look at air travel and pulmonary embolisms.
The myth is that pulmonary embolisms happen frequently on long-haul flights. The truth is they don't. But because PEs can be life-threatening, you should know your risks, how to prevent them, and the symptoms should one occur.
These events after long-haul travel are very, very infrequent.
Dr. Robert McBain, a Mayo Clinic cardiologist, says a pulmonary embolism happens when a clot called a deep vein thrombosis travels from an extremity, most often your leg, up through the inferior vena cava to your lungs, where it gets stuck in an artery. Small clots may not cause much trouble, but big ones can block blood flow from the right side of the heart, causing symptoms. And in extreme cases, the abrupt onset of right heart failure can cause death.
Most people will survive their pulmonary embolism. A very small percentage will have a fatality. And because there is potential mortality associated with these events, we would want patients to be promptly evaluated so that prompt therapy can be initiated.
Therapy involves short and long-term blood thinners. McBain says there's no way to predict who will have a PE or when one might happen, but you're at increased risk after major surgery, major trauma, if you have cancer, if you have a relative who's had a PE, if you've had a PE in the past, or if you've had a long, prolonged time of immobility, such as in a nursing home. But 1/2 of all cases happen without an explanation. So how can you prevent PEs if you're on a long flight?
For the really high-risk individuals, sometimes we give them a preventative dose of blood thinner therapy.
If you're not at increased risk, McBain recommends you stay hydrated, stand up or walk the aisle every couple of hours, stretch your legs while sitting, and wear compression stockings.
You know, we tend to see that a lot. We explain that by what we call virtual triad. 3 things are occurring that set you up for that blood clot. And the first thing is the blood flow is slow, what we call stasis. But then you also have to have an injury to the blood vessel. And when that vessel is injured, then platelets can come and plug it up, and that produces clot, all right? And then the third thing is you have to have what we call a hypercoagulable state, meaning there's something that's happening that's allowing your blood to be thicker. So you put those 3 things in movement, and you can get a blood clot, usually coming from the lower extremities, like you said, deep veins, thrombosis, clotting. People will experience like chest pain, shortness of breath, rapid heart rate, or leg swelling or pain. You tend to see people with that calf pains and things like that.
I was wondering about like physical conditioning or exercise before you go on the plane.
It's not going to help you because you're sitting there and you have a slowing of the blood flow.
Leg pumps. So,
Yeah.
so doing those foot pumps that we like you to do when you're in the hospital to keep your legs pumping, because if you can keep that calf muscle contracting, you're going to keep the blood flow. But it's important to note that almost all professional athletes that fly and travel wear compression socks.
Okay.
So this isn't just an older person thing or a frail person thing. You know, a lot of people do, right?
My sister does.
Yeah.
And she's a nurse, so she's way ahead of the
Because
curve.
she knows it's the setup is that your blood is not flowing.
Yeah.
That's the setup.
Yeah.